Music therapy is an evidence-based health profession. It's the planned and intentional use of creative music making to address specific clinical goals. Music is created by the therapist and clients together within a therapeutic relationship. So music therapists work as valued integral part of multidisciplinary teams. Music therapists work in a variety of different areas: communication difficulties, physical problems, cognitive, psychosocial, and specifically emotional problems.
Our evidence base comes from research conducted with people through the lifespan: children, infants, teenagers, adults and older adults. And our research comes from all over the world, from different universities, different hospitals and different contexts, and is published in the international literature. When we talk about the evidence base, sometimes when you hear about evidence in healthcare, you can think about these levels of evidence. And you sometimes see a pyramid where the more prevalent evidence is at the bottom, and then perhaps the more robust evidence. There's less of it usually, but it's right at the top. But I tend to think about it in terms of intensity. So the lower intensity is often areas like, where we would use expert opinion, for example. So when a practitioner has been working in a field a long time, they tend to gain expertise about the effects of the work that they do. For example, I used to work with children in a hospital, and during pain treatment, so where children were perhaps experiencing pain, and I was providing music therapy to help them alleviate their pain, I gradually realised with colleagues that when we sang a song that had lyrics or was very familiar to them, it often wasn't as effective as when we perhaps hummed or used a melody, and that would be expert opinion, and then I would speak about that at a conference and share that with colleagues. Increasingly we're finding that for children who have autism and for people who have mental disorders, that the evidence is very robust that music therapy can deliver an effective treatment that is very beneficial to them. For example, for people with schizophrenia, the National Institute for Clinical Excellence in the UK, they published findings a couple of years ago to show that the arts therapies were the only therapies, psychological or pharmacological, that could deliver benefits for the negative symptoms of schizophrenia. So they're the symptoms that stop a person from going to work or having relationships with other people, feeling antisocial, not wanting to get out of bed in the morning. Music therapy delivers benefits for those patients.
Music therapists assess the need of clients and plan, implement and evaluate therapy interventions to address specific clinical goals. A variety of music-based experiences are offered to assess need. A treatment program is designed utilising music-based interventions identified during the assessment. During evaluation, the therapist will often refer to the client's musical progress and development as a reflection of change in the client. In a music therapy session, interactive music is created by clients and therapists. A variety of interventions are used to achieve therapeutic goals: instrumental and vocal improvisations, structured music making, music listening, songwriting, lyric discussion, music and imagery, and music performance. The therapist derives meaning from the client and also from the music they create.
This is a case study of a little boy who, as a result of his injury, was unable to talk. He had very limited physical movements, and he had quite a profound cognitive disability, and processing was very difficult for him. And the aims of his music therapy session were really for him to have the opportunity to express himself beyond his language limitations, to be in a relationship where he could communicate something about himself. And in the sessions, the main issues that came up was the issues of control. He really valued and seemed to get so excited about the fact that he was in control of the music. Everything that I played was connected totally to him. So my vocal sounds matched his vocal sounds, the music I was playing matched his body movements, and also the emotional quality, what it felt like being in the room with him at the time. He realised this, and he realised that he was in control of what we were doing, and you can see at the very end he just wanted to have the last word. And I think his delight is obvious when he realises that he can convey something about himself, and he can communicate something with another person and be heard through his music.
My name is Professor Des O'Neill. I'm a consultant in geriatric and stroke medicine at Tallaght Hospital, and I'm also the chair of our National Centre for Arts and Health. We're very involved here in Tallaght Hospital in terms of arts and health, running an active programme with music and art, and in particular we've music and art therapists in our psychiatry department and also in paediatrics, but sadly not in the wider adult departments of the hospital. Arts and health are hugely important to all of us, and we don't miss the well until the water runs dry. And this is very true. For example, think of how much we spend on our CDs, our music, going to films, even our television stations, arrange newspapers, books. Culture is hugely important to us, and very often when we get ill and go into a healthcare setting, we get removed from these very important supports. And it really is important to re-establish these links, because they're a very important part of how we express ourselves, how we understand the meaning of bad things that are happening to us, and great supports in terms of us getting better and cure and getting towards an accommodation with what has changed in our life. I'm particularly impressed by what I've seen so far of arts and music therapy in terms of specific formal therapies. They really do open windows and avenues for people with significant disability into expressing themselves, into allowing their emotions to take form and take shape. And certainly in terms of stroke, we would very much welcome the presence of music therapists and art therapists in our unit. Equally, for dementia and movement disorders, this is a hugely important way of establishing our humanity and of augmenting and supporting the other ways we look after people with illness.